Good evening, everyone. This is Ron Tyler with the Emergency Management Associates coming to you live from the Crossroads of the West in Salt Lake City, Utah. The time right now is 6:06 p.m. on Monday, March 23rd, 2020. We want to welcome everybody here that's joining us right now in our chat rooms, online, lurking, or who will join us later in the program or on a delayed broadcast basis. Thank you for being with Emergency Management Associates. First off, I want to tell you guys something that has been hitting me in the head today. I wanted to first tell you this. During this time of health and economic uncertainty with unknown perils all around us, I'm reminded of a man who I looked up to during my children's growing years when he was on TV, a man who dedicated his life to helping others, especially our children, with emphasis on our children, Mr. Fred Rogers. I'm reminded of his advice, his endless messages of kindness, courage, and compassion. He said, when I was a boy, I would see scary things in the news. My mother would say to me, look for the helpers. You will always find people who are helping. This was evidenced to me yesterday during a local news conference with the governor of Utah, Gary Herbert, and the coronavirus task force that Governor Herbert put into play with the assistant governor, or what's he called? The vice governor, the assistant governor, anyway, Mr. Cox, who is a wonderful man in and of himself. But yesterday during this news conference, it was all about a man who had passed away, a man who had just come to everybody's minds the day previous on Saturday. His family had called the hospital that they took him to just prior to taking him to the hospital to tell the hospital that they were en route that they believed that he had the coronavirus and that he now needed hospitalization. The people at the hospital were literally angels. Those people were literally angels. They took care of this man till the time yesterday when he uttered his last breath. These angels with wings had been with him and with his family and kept his family apprised of what was going on during the past day and a half before he passed away at Davis County, Utah Hospital. Those people showed by their actions that the life that had been lost truly mattered to them. During this coronavirus crisis, we all are constantly seeing countless angels ministering to those who become sickened and are helping those who are suffering and dying, making the lives of those people better, comforting some, like I said, to their last breath, administering to those of us here to become better so that we're better able to support and serve in our families and in our communities. To those doctors and nurses, healthcare practitioners, healthcare providers, as even my own, we thank you for your support of those within your reach, both physically and your extended outreach to all of us. We sincerely appreciate and love each and every one of you. We want you to know that. Thank you for being a part of our broadcast. There are people here that are in our chat rooms. There are people here that listen to and watch our broadcast. They'll never make our chat room. that are doctors, nurses, emergency managers in your own communities. There are mayors. There are other politicians throughout this government here in the United States and in other governments throughout the world. We appreciate each and every one of you. Thank you for becoming part of our broadcast, for your spiritual, your emotional, physical, and yes, even your financial support to make sure our programs stay on the air. We really appreciate what you do for all of us. I want to thank those that continually send us information, evidence, and information of events that are happening all around us, so that we can provide this information to our worldwide audience. We all are blessed by your efforts. And I want you to know from the bottom of my heart how much I appreciate each and every one of you. And thank you. Now, I also want to talk about a doctor in Italy who says he and other physicians are no longer permitted to put coronavirus patients who are over 60 years old on ventilators. Sorry about that. We're no longer able to put coronavirus patients who are over 60 on ventilators. An Israeli doctor in Italy said he and other physicians have been directed to avoid giving over 60 patients ventilator treatment in response to the COVID-19 outbreak, because many of these patients, by the time they get to the doctors, they are on their last legs, and the doctors now are triaging patients. And this bothers me because I've had to do it during my career. I've had to decide who's going to live and who's going to die. And that's what these physicians are having to do. If they put one person on a ventilator that they can't save, then the person they could possibly save may also die. And this is a hard decision for these people to make. Italy has seen at least 59,138 COVID-19 cases, and over 5,476 people in Italy have died as a result. 3,405 people died as of Thursday this past week. The doctor says what he sees and hears in the hospital, the instructions are not to offer access to artificial respiratory machines to patients over 60, as such machines are limited in number. And that's been the problem here at local hospitals and also hospitals throughout the United States. More ventilators are coming online. More ventilators are being built by companies such as GM that are retooled their machines to make ventilators. Other businesses here in the United States and elsewhere have also done the same thing. Other companies are making masks. They're making surgical gowns. And they're making other equipment so that first responders, doctors and nurses, and other healthcare practitioners are able to protect themselves from this COVID-19 virus. Some hospital staff are furiously working to tend to gravely ill patients. It's a massive strain for any healthcare system. Some hospitals are seeing 50 to 60 patients or more who come into the emergency department with pneumonia. And most of them are so severe they need every high volume machine that's available to give them high volume oxygen. And so they've had to reorganize their emergency room, their hospital, and have different levels of intensive care to take care of these patients. Even bed availability in some hospitals has gotten sparse. It's a sad day. It's a very sad day. A lot of countries, including Italy, as of today, have moved to stop all domestic travel. So they're no longer taking people from other countries. They're no longer allowing people from other countries to come into theirs. Just so you know, here in Utah alone, we've had, let me pull it up right here real quick. We now have 257 people in Utah with the coronavirus. 5,000 people have been tested. In different counties, they have people that have the coronavirus. Bear River Health District, for example, here in Utah, has 4. Davis County, where the man over 60 died yesterday, has 29 residents that have coronavirus. Salt Lake County, where I live, has 109 residents and 3 visitors. The Southwest Utah Health District has 4 residents. That's down over by St. George, Utah, Southwest Utah Health District. Summit County, over by Park City, has 65 residents and 8 visitors with the coronavirus. Tooele County, just northeast of us, has 2 residents. Utah County, south of us, has 11 residents and 1 visitor. Weber County, Morgan Health District, up by Logan, Utah, in northern Utah, has 8 residents. Okay. Previous to today, as we reported yesterday, Utah had 182 people that have caught the coronavirus. Now they have 257. That's a lot of people. That's nearly 100 people in one day, in just 24 hours, that have been diagnosed with the coronavirus. Yes, we have done more to bring more patients in to get checked. Okay, that's the reason for it. We've now tested 5,000 people, and we'll be testing a lot more here in Utah and throughout the United States. Now, before we go any further, I want to bring on the governor of Washington, but before we do that, I want to bring on Glenn Beck, who's going to talk about the military plans for COVID-19. A lot of people are interested in what is going on with the military, the National Guard, and rightly so. Okay, I want you to hear it from Glenn Beck. Glenn, go ahead. Oh, darn it. I think we've lost Glenn Beck here. Hold on just a second. Let me see if I can find him.
show on Wednesday on what is happening, and I got a call from several people who said that they had been put on alert, and that is true. They've been put on alert for War Nord. That's the actual alert, War Nord, and I'll tell you about that coming up in just a second. But if you know of anybody who has been put on alert, you'll understand why here in a minute. But there's some other things that are going on. Now, there's new documents and interviews with military experts obtained by Newsweek that show various plans, codenamed Octagon, Freejack, and Zodiac. This is to make sure that our government has continuity. And they are so secret under these extraordinary plans that de-evolution could circumvent the normal constitutional provisions for government secession. They're thinking that America could go into such a bad panic that we have to enter into new territory. We're talking about extra constitutional things which should chill you to the bone. The guy's name that everybody should know is Terrence O'Shaughnessy. Who is Terrence O'Shaughnessy? Well, he's the guy, he's the lone survivor. In case the government goes down and no one is a constitutional successor of it, Terrence O'Shaughnessy is the general that is the combatant commander for the United States. He'd be in charge of Washington if everything in Washington went down. They're saying now that we're in completely new territory where they don't know what to do. For instance, they're planning for a contingency if so many members of Congress come down with the coronavirus that the legislature can't meet or can't muster a quorum. If they don't have a quorum, they can't do anything. Now, the question is, so what should you do? Now, I think right now the government should be preparing to get everyone out of Washington, get every single representative and Senate back to their homes, get them into their own district. Enough of this meeting like it's 1800. Can we go to the meeting again still with are the Democrats still debating this bill for the bailout? Do we have that? Apparently not. Apparently not. They're quieted down a bit. There is an interesting thing here about why we still have these guys meeting in Washington. What good is that? It makes them a target. It makes them not only a target of bombs, of anything like that, but it also makes them a target of lobbyists. Imagine what we could do if the lobbyists didn't have a home in Washington, if they had to travel like traveling salesmen, and they couldn't stop at one office right after the other, and take them all out for a drink. They had to travel. That would eat up so much of the lobbyists' money and time that I think we'd gain a lot. I don't read anywhere that the government is looking into actually moving Congress into a virtual kind of scenario, but that's exactly what should be done. Now, they are looking at the possibility that help doesn't come from the outside. We've always looked at a nation where help came from the outside. In other words, a state or a city was having a problem, and the government, the federal government from the outside, one of the other states or groups of other states could go in and help. But they're saying on this one, they don't think there will be help on the outside in the worst case scenario. So they have Con Plan 3400, the military's plan for homeland defense if America itself is a battlefield. Con Plan 3500, that is the defense support of civil authorities where the military assists in emergency short of armed attack on the nation. And Con Plan 3600, military operations in the national capital region and continuation of government under which the most secret plans to support continuity are nested. All of these fall under Air Force General O'Shaughnessy. and he is based in Colorado. Now, Northcom has executed orders for nationwide pandemic plans. They were signed by the Defense Secretary Esper, and they are warning orders, the War Nord, as it's called, alerting Northcom and a host of East Coast units to prepare to deploy in support of potential extraordinary missions. I heard on Friday or Saturday from several people that said they've just been put on standby alert. And they said it was for the possibility of some sort of martial law, and they didn't know what it was. And I said, okay. So I went and I bought all the M&Ms I could find. And so I'm stocked with sugar, because if I'm going down fat and happy, man. I'm going down with a pant load of Oreo cookies. I don't know about you, but I'm eating it again by the sleeves, and I don't have a problem with it. Anyway, so I started looking into it, and it's not for a nationwide order. It is instead for places like New York that are getting really bad, California getting really bad. And these governors, stop asking for the federal government. I'm sick and tired of these governors and these mayors blaming the president. And yes, I would say this if Barack Obama was the president. It's not the president's role to call the National Guard out. The National Guard is a part of the U.S. military that is under national control unless there is a problem in the state. And then that governor can say to the president, I'm pulling my troops back because we need our troops here at home. That's how that works. And you want it to work this way. The less the federal government does, the better. I don't know if anybody is watching these press conferences with the president, but you have to read between the lines. You have to not even read between the lines. You just have to get past the use of incredible, huge, never seen before. You got to get past all of that stuff. And yes, it is difficult because now is the time when he could use that. But he was like, no one's ever seen a turnout like this before in the stadium here where I'm at, where it's all sold out. Never been done. Huge, incredible. You know, the stadium's been sold out before. But now when he's saying never been seen before, he's actually right. When he says huge, he's talking $4 trillion of bailout money. Yeah, huge, never been done before. Exactly right. But he's on it. And when he was asked about why aren't you forcing these companies to make these things? First of all, because they don't have to be forced. They're volunteering. They want to do it. They're doing the American thing. Why would we immediately start with, Ford, we're taking over your company? Why wouldn't we start with a phone call? Hey, Ford, we really need, your country needs you. That's the way even FDR did it. We didn't just go in and take companies over. So now there are 7 very top secret plans that are being put into place right now, just in case this whole thing comes apart. But I have great confidence that America is not going to devolve into riots across the country. We're not those people. We're better than that. We don't want a revolution. We want to go back to work. Now, the president and the GOP better understand that if they bail out the banks and they bail out big businesses and the average person can't get a loan, the average person loses their job in a small business and that small business is not getting the same kind of help that GM would get, they're going to have a real hard time getting reelected. And there could be disruptions in our civility. I hope that doesn't happen. But I think the president gets that. I'm not sure about the GOP, but I think the president really, truly gets that. The help this time cannot go to the banks alone. It has to go to the average American as well.
Thanks, Glenn. We appreciate it. Thank you very much. Folks, that was Glenn Beck telling you what is going on. Okay. He mentioned about the National Guard. Now, I mentioned the National Guard on my on a Facebook post that I put up, and I was taken apart by it. People that I knew, that I was friends with, tore me a big one. Guess what? In several states, the National Guard has been called in by the governor, just like I said they would be. Okay? People don't believe it. They just don't believe it. And that's sad. That's very sad. I find it hard to believe that my friends would say, oh, that's not gonna happen. Yes, it is. And all of them, all of my friends need to realize what is going on. Now, I also, I also saw a blurb that came across my news feed, that not on Facebook, but came across on my my own channels, that, and this came from people that I trusted to, that I've been with on drills and such, but it said that the National Guard was going to be called in. And they were right. And yet I was told, where did you get that? That's not true. I can't believe that would happen. Yeah, folks, it can and will happen, okay? It already is. Now, I'm trying to bring up the Washington State feed right now. Let me see what I can do to I think this is going to be it here. Yes, here it is. It's coming up now. Let me bring you up on this as well. Hold on a second. I'm sorry you guys might not have heard Glenn Beck. I'm sorry about that.
The company tells us they've got word of 32 employees that have tested positive, most of those in our region. Now you're seeing the action. That is why we fielded all these calls. That is why what happens next matters so much. Thousands of workers are learning about this shutdown in real time. Our phones lit up with a little more than an hour ago. Personal cell phones, work cell phones. A lot of people want to know what happens next. And the key here, people are still working today. Yes, production will be suspended, but they're going through the procedures to shut everything down. In fact, the first day the plant will be closed, that happens Wednesday. So let's take a closer look at how this works. The production officially begins, the shutdown that is, on Wednesday, March 25th. That information coming directly from Boeing. The company says this is a 2-week shutdown. During that time, crews will be coming into the production facilities to do what they're
this was going to be the governor. Just a second. Let me see if I can find out anything else here about the governor talking. We know about the shutdown of the Boeing plant.
Smith is at the live desk for us. And Matt, we've gotten call after call, email after email into Cairo 7 about this. Now Boeing is taking action. This came in just after 10 this morning.
Yeah, Michelle, this is huge news, but let's add some.
Okay, that was the same story. This is the same story too. Apparently the governor has not gone on yet. Well, maybe he has. Okay, Governor Jay Inslee announced a statewide stay-at-home order Monday, effective immediately with some exceptions for essential activities and business. Every resident is required to stay home unless going shopping for groceries, going to a doctor's appointment, going to work at an essential business as defined in Inslee's executive order. All public and private social, spiritual, recreation gatherings are banned. All non-essential businesses are closed. The Department of Health updated its statewide count today to 110 deaths from 2,221 cases as of Monday today, 3 p.m. This afternoon. The department releases new statewide case numbers daily between 2 and 4 p.m. King County reported 12 new deaths Monday, today bringing the county total to 87 deaths among 1,170 cases. The death toll in Snohomish County increased by 1, bringing the county total to 11 deaths among 519 cases. Thurston County still reports no deaths among its 11 cases. Pierce County, Washington announced 19 new cases Monday, bringing the county total to 1 death among 126 cases. We know that Boeing announced it was shutting down its Seattle area production facilities for 2 weeks. President Trump approved the use of National Guard in Washington, California, and New York on Sunday yesterday, but said state governors will retain control. Governor Jay Inslee had already approved it for use. The mayor of Edmonds issued a stay-at-home order for residents. The mayor of Everett issued a stay-at-home directive to residents. Inslee signed an order that shut down restaurants, bars, dance halls, clubs, theaters, health and fitness clubs, and other similar indoor social or recreational venues until March 31st. Restaurants are limited to takeout, grab and go delivery. Find the list of business closures in the information from local officials section. Okay, that's just in Washington. The same thing applies here in Utah. Restaurants are only allowed to serve grab and go pickup deliveries. The Center for Disease Control and Prevention has revised guidance recommending that no events with more than 50 people for 2 months. Federal officials recommended people avoid gathering in groups of 10 or more people. And that's usually the advice given to every state, and it's being enforced in a lot of areas. Idaho, 2 counties in Idaho, Blaine County and one other county, I don't remember which one it was, but both those counties are actually arresting people for violating the order to shelter in place. I fully expected to see the governor here, and apparently he's already done his briefing. That's too bad. That's sad. I was hoping to catch that briefing here. Let me just see if I can bring it up here real quick. See if it's part of this briefing here. You see Chuck Schumer there. And here's Mitch McConnell this morning.
This is the moment to debate new regulations that have nothing whatsoever to do with this crisis? That's what they're up to over there. American people need to know it.
It includes a large corporate bailout with no protections for workers and virtually no oversight. Also very troubling in the bill were significant shortfalls of money that our hospitals, states, cities, and medical workers desperately needed.
One key holdup appears to still be the roughly $500 billion in funds for loans and loan guarantees for companies and states. As the minority leader said there, Democrats are concerned about the limited guidelines and oversight for those loans. So let's take a look at how the markets are doing.
The markets didn't like what went on today in Washington, D.C. And
Right now, we have less than an hour until the closing.
they went down
Officials say 23
617
residents and
points
6
today.
staff members at the Shuxon Healthcare facility
I'm just
tested
looking
positive.
to see
Before
if the
yesterday's
governor-
announcement, it had just 3
Nope,
cases.
apparently the governor was earlier today. I'm sorry about that. Anyway, you heard Mitch McConnell try to call the Democrats on the carpet today for not willing to negotiate in good faith. The Democrats, on the other hand, were saying that the Republicans did not let them be part of the original negotiations of the bill that the president wanted to have put forth. And so they weren't going to be part of it. And they said that they were not going to be allowed to do anything, so they weren't going to sign any part of the bill. So what it amounts to is we still don't have a bill that the president promised us that would give us money coming to us in the form of a check to each family throughout the United States, starting approximately April 15th. And so far, that's not going to happen unless Democrats and Republicans come to the table and make it happen. What happened this morning, from what I understand, from all the news that I can gather, piecing together everybody's story, is that Congress, both the Senate and the House, were coming together to go over the bill to approve it and get it ready for the president's signature. And Nancy Pelosi came back from her recess from Congress, and she had her own mindset on what her agenda was going to be, and that was to make sure that that bill wasn't going to go forth to try to make the Republicans and the president look bad. That's the information I can gather. Now, I've heard both sides, and in fact, I made mention on Fox News about my opinions of what happened in Washington, D.C. today. It's a farce. If the Republicans didn't allow the Democrats to be part of this coronavirus bill, that would have been wrong. But if the Democrats came in today, like has been said Nancy Pelosi did, that had her own agenda of giving, for example, Planned Parenthood money, no, you just don't do that. You don't do that. You don't add entitlement bills onto something that is supposed to be for saving the lives of people, saving their homes, saving their businesses. Okay, you just don't do that. But that's what seems to have happened in Washington, D.C. today. It's just sad. It's completely sad. Today, here in the United States, I went on worldometers.com, and you can go there yourself, worldometers, worldometers.com, and you can pull up this information yourself. But as of about 1 hour ago, this is what has gone on here in the United States. So far, and these are numbers from yesterday to today. Gosh, where'd my numbers go? Well, that's just really weird. I had the numbers right here in front of me, and now I don't. So let's go over here. We can pull it up. It's not a problem. And we can go to it as you are seeing it, as I'm seeing it. Worldometers.info. I'm sorry, not .com, .info. Today, we have 378,741 coronavirus cases throughout the world. We've had 16,501 deaths. Recovered, 101,608. Okay, active cases, those in mild condition, 248,394. Serious or critical condition, 12,238. In other words, 5%. The number of closed cases are 101,608, 86%. Deaths, 16,501, 14%. As you can see, the graph of total cases since January 22nd, it's literally skyrocketed every day. The number of deaths gradually rose and has skyrocketed, okay? Now, we can go here, we can show China, a total of 81,093 cases, and they said their caseload is going down. I can hardly believe that because so far they haven't been truthful with any of their cases. Anything that's happened in China, they have not told the truth. They said they've had 3,270 deaths. Really? How come Italy far surpassed, almost tripled the number of deaths? They're a smaller country. Come on, China, bring out the truth. Don't cover it up. Here in the United States, we've had 43,718 cases. We've had 10,152 new cases just since yesterday. And again, that's because we are testing people. And the more and more people that are tested, the more and more coronavirus cases we're going to get. We've now had 551 deaths as a result of the coronavirus. Okay, new deaths, 138 more. Okay, total recovered, 295. Total active cases of 42,872. Serious condition, 1,040, which remains the same as yesterday. Total case population per 100 or per 1 million population, 132 cases per 1 million population. Okay, and there's total countries we can go through, but I wanted to give you the numbers as they stood out today. Okay, Italy, China, the United States with the most cases, then Germany and France. Okay, even Angela Merkel has been diagnosed, German Chancellor Angela Merkel has been diagnosed with COVID-19. So it's happening and it continues to happen. It's not going away. Texas had one county that went under mandatory shutdown yesterday. Louisiana joined the number of states under shutdown today. Louisiana governor announced that this morning. Louisiana is shut down. Again, that's Washington, parts of Oregon, all of California, all of New York, New Jersey, and I believe Connecticut now, and now Louisiana, Illinois, and Ohio are all under immediate shutdown orders. Okay, that's what's going on. That's what's going on. Now, it's not going to get any better. It's just not. I am going to pull up some information for you to show you everything that's happened during the past 24 hours. Deputies in North Carolina found someone with 18,000 pounds of toilet paper in a stolen trailer truck in North Carolina. 18,000 pounds of toilet paper in a stolen truck. That's insane. A Chinese billionaire is shipping 500,000 coronavirus testing kits to the United States. Okay. My only issue is I don't trust, and I don't know whether we should trust the Chinese. Are these testing kits going to be accurate or only partially accurate? Are they going to be any good at all? Are they going to be sterile? Or are we going to have to disinfect everything once it gets here to the United States? I question that. I question it. It's just incredible. Also today, in New Zealand, 6 people were found dead, including 3 children. And well, I'm sorry, this wasn't in New Zealand. This was in Indiana today. A bridge collapsed and 6 people were killed, including 3 children, during a flood in Indiana. That's horribly sad. I'm going to bring up some information about Los Angeles that I think everyone needs to see. I believe this, no, it's not. It's not a video. And it's not Los Angeles. It's in my stomping grounds in San Diego. Chula Vista Police. In fact, I'm going to bring you guys into it too. I'm going to share this with you. Hold the phone just a minute. I want to share this with you. This comes from sources at law enforcement officer. You normally couldn't see this information unless you were either a present police officer or retired. The Chula Vista Police Department in Southern California plans to use drones equipped with loudspeakers and cameras to enforce a coronavirus lockdown. According to Financial Times, Chula Vista Police bought 2 $11,000 drones, doubling the size of its fleet, and plans to rig them with speakers and night vision cameras. We have not traditionally mounted speakers to our drones, but if we need to cover a large area to get out an announcement, if there were a crowd somewhere that we needed to disperse, we could do it without police officers involved, according to the captain, Vern Sally. The outbreak has changed my view of expanding the program as rapidly as I can, he added. Now, 152 Detroit police officers were quarantined as 5 of them tested positive for the coronavirus. Okay, that's another story. And then there were people that were saying that they were going to purposely give people or police officers the coronavirus. That's just wrong. That's just wrong. So anyway, I told you what the Chula Vista Police Department is going to do. I guess from what this article says, They're going to run 15 operations per day, but only for emergency situations. He's now working with the FAA to expand usage to protect the community during the virus outbreak. The crisis could be a catalyst to spur the FAA to free up resources faster, according to this Captain Solly with the Chula Vista Police Department. And that's not the only thing. That's not the only thing that's happening. Let me pull up this other information here. I wanted to show you this, just a second here. This happened this morning. The USNS Mercy came into San Diego Harbor, or not San Diego, Los Angeles Harbor and docked, and they're on their ship. They have 800 personnel that they'll be able to care for on their hospital ship. Okay, they will free up the hospitals on land there in Los Angeles to tend to coronavirus patients. The only patients that the USNS Mercy will take care of will be regular hospitalized patients. Okay, that's what's going on in Los Angeles today. The USNS Mercy pulled into port, and they're going to start operations very shortly. They're going to start operations very shortly. Mount St. Helens. Oh, darn it. I did turn that video off. Okay, now I turned that off. I'm sorry about that. I wanted to show you this video here. This is Mount St. Helens today. This is Mount St. Helens today. Mount St. Helens steamy. A steam eruption occurring at Mount St. Helens. A steam eruption at Mount St. Helens. And yet, the powers that be that I personally spoke to said that Mount Rainier wasn't steaming. That was all false.
Mount Adams. Mount Hood.
Did you see that no snow was on that side of Mount Hood?
If I can find Jefferson is over there somewhere.
Okay. That part of the video that showed Mount Hood, no snow. Imagine that. No snow on Mount Hood. What's up with that? What's up with that? Because usually there's snow on Mount Hood. But again, they're not being honest with us. They're not telling us what is going on. They're just not being honest with us, which is sad. Okay. I've got some more information here to share with you. Gosh, what else here? Doctors and nurses across this country are buying face shields out of their own pockets. Okay, I wanted to show you this information too. Okay, it's a sad state of affairs when, and I found it, we have people that are part of our emergency management associates team here that are doctors and nurses, and they were told by their hospitals that they're going to have to start providing their own equipment because the hospital doesn't have enough. That's sad. They gave them one PPE. And if they need any more, they're going to have to get it themselves. It's just sad, just very sad. Let's see here. Over in Arizona, a man stole dozens of highly sought after coronavirus test kits from an Arizona clinic. And so they're searching for that man now. I wanted to play this. This is a news story from Idaho from yesterday. And today I just found this. And I wanted to play it for you. I hope it's here. And they've taken down the video and all they have is the story. This is out of Bannock County, Idaho. Idaho Public Health has confirmed 2 cases of COVID-19 in Bannock County. That's where I used to live in Pocatello. This brings the total to 3 cases in southeastern Idaho, bringing the total number of confirmed COVID-19 cases in Idaho to 49. The patients are males in their 30s from Bannock County who both had a history of travel. They are both recovering at home so far. The investigation into this is in its primary stages. Protecting, preserving the health and safety of our residents is at the very core of what we do, said Maggie Mann, SIPH District Director. We are calling on each of you to follow public health guidance to help protect their families and prevent the virus from spreading. We must do all in our part to prevent the spread of the virus. If you are sick, and this goes not just for Idaho, this goes for everywhere. If you are sick, limit contact with others, avoiding people who are sick, washing your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Covering your nose and mouth with a tissue or your sleeve when you cough or sneeze. Avoiding touching your eyes, your nose, and mouth with unwashed hands. Cleaning and disinfecting surfaces and objects that may be contaminated with germs and using a disinfecting solution. If you believe you've been exposed, make sure to self-isolate. If you need medical attention, please call your healthcare provider in advance of a visit to discuss your symptoms and the next steps that they want you to do. Public Health does not do testing for COVID-19 in Idaho or store testing kits. The Southwest Idaho Public Health Department's focus is slowing the spread of COVID-19 to ensure the protection of our community. Okay, that's out of Pocatello, Idaho. I was hoping to show you that, but they took down the video. There's now 72 cases in Idaho coming from one of our associates in Idaho that just gave me that information. That just came across. Nova Scotia. There's a COVID-19 update for Nova Scotia coming out of the Chronicle Herald in Nova Scotia. I'm going to give you that information in just a half a shake here. Okay. The latest update from Nova Scotia in Eastern Canada. To date, 41 cases of COVID-19 have been identified in Nova Scotia, and a state of emergency was declared yesterday. Okay, a state of emergency was declared yesterday. I'm going to show you this information real quickly. Come on. There we go. I'm not going to play
An online questionnaire that'll give you further direction about whether you should be then calling 811 and getting in for testing.
Thank you, Dr. Strange. And we are at a state of emergency today, and we've tightened our borders up. At the Nova Scotia and Brunswick border, it was a slow process today, and we had a number of workers caught in lineups. This will smooth out. We are creating an essential service line that will make it faster for those who need to get across. Healthcare workers, those who work in financial institutions, manufacturing of essential goods, construction, and truckers supporting trades. Use common sense. If you are not an essential service worker, you should not be crossing the border. You should stay home. We have stopped social gatherings of more than 5 people. Our beaches and parks are shut down, and I want to thank Nova Scotians for following this emergency order. I know this is tough, but we don't have a choice. This is serious business, and I can't say that enough. You can still get your groceries, go to the pharmacy, go for a walk around your neighborhood, but do not travel in groups. We will now try to answer any of the questions that we can here today, and if we can't answer them today, or if more clarification is required, we will post it online.
Okay. That was a statement from Nova Scotia Health Department giving information of what is going on in Nova Scotia. And then they took more questions. So folks, it's everywhere. And they're giving the same information. Stay home. If you don't want to catch the virus yourself, stay home. Now, questions were asked about the spring break kids that were out running around on the beaches of California and Florida when there were stay-at-home orders issued there. Why are they doing it? Well, now Florida has issued a no travel advisory. Hawaii, where they were inundated with beachgoers during the weekend, Hawaii is now closed down to anyone coming to Hawaii. No incoming flights from anywhere. Hawaii's now gone on shutdown, along with Washington, some parts of Oregon, all of California, one county in Texas, and the state of Louisiana, New York, New Jersey, and I understand parts of Connecticut as well, and Illinois and Ohio. But for Hawaii to say no more, they meant it. And I guess they're going to be sending people back to where they came from. Folks, this is serious. They are dead cotton picking serious. If you don't belong, stay home. Stay home. Stay home. I don't want to cause problems for anyone. We are sheltering in place. The only place we're going to go is the grocery store, and it's not going to be me. My doctor said 2-week shutdown for me. That's what it is. I'm not going anywhere. And by this time, the middle of this week, I believe Wednesday, I think our governor here in Utah is going to have a shutdown in Utah. That's my own opinion. No, I have not spoken with Governor Herbert or any of his staff, but I believe that's what's probably going to happen. It's happening everywhere. It's happening everywhere. And you guys need to be notified. Everybody needs to be notified of what's going on. I might as well, I think I ought to show you this. I think I've got the video. It was a video this morning. Oh, doggone it. It's not a video. What they are saying is the University of Utah Health is detailing more testing for the coronavirus. They say anyone with symptoms will now be tested at drive-up stations that they have put up all over Utah, especially here in the Salt Lake area. The Salt Lake area station is over in the Sugar House area. Those of you that listen and watch our program here in Utah, in the Sugar House area, you can be tested there. They have a drive-up testing tent set up in Sugar House, Utah. I'm sorry that they took down the video. Doggone it. One of our people that gives us information sent us this. Is it safe to travel? Avoid it if you can, doctors say. As the coronavirus cases surge, doctors are underlining the message that sticking close to home is the best way for individuals to help slow the spread of the coronavirus. To flatten the curve, people should be staying home, practice social distancing, and avoiding all non-essential travel. So Dr. Geoffrey Gottlieb, who specializes in infectious diseases at the University of Washington School of Medicine in Seattle, staying at least 6 feet away from people that you're not around. Stay away from them. If you're not in isolation, it's a key to stopping the spread. It's called social distancing. Follow the travel advice of your local public health department and the U.S. Centers for Disease Control and Prevention, keeping in mind that the situation is changing rapidly. Leisure travel is not a good idea right now. If you're going for vacation, I would suggest you don't go, said Daniel Ompad, an associate professor at New York University School of Public Health, Global Public Health. I definitely don't suggest you visit anyone that's sick or elderly. Travel bans, border closures, mandatory quarantines, and flight cancellations have been implemented across the globe, with more restrictions likely. These can be unpredictable and implemented during travel, so U.S. travelers face a high risk of travel disruption and might even have difficulty returning home, said Dr. Henry Wu, assistant professor and senior physician at Emory University School of Medicine and director of the Emory Travel Well Center in Atlanta. The U.S. State Department on March 19th raised its global travel warning to the highest level, level 4, do not travel, advising citizens to avoid all international travel. And if you're already someplace else other than the United States, you have only a short time period to make it back here to the United States, or you're going to be trapped in the country you're in, where you're not going to want to be. And you may have trouble being there staying there for whatever time limit that is imposed. Travelers should heed the warning and not travel internationally, where they may face significant difficulties. Airlines, rail, and transit systems have stepped up sanitation efforts, but the best bet to stem the coronavirus spread is to stay home. In the absence of containment of COVID-19 in the US, the best way for Americans to protect themselves and limit the spread of COVID-19 is to avoid unnecessary travel outside the home and avoid large gatherings. If you must travel by air or rail, Dr. Wu encourages taking the standard precautions. Thoroughly and frequently wash your hands. Avoid touching your face. Cough and sneeze into a tissue or your elbow. Don't travel while ill, and practice social distancing to the extent possible. COVID-19 has been reported in every US state and across many countries. Dr. Wu noted that many areas are less affected than others, and limiting unnecessary travel will limit the spread to those areas. Retreating to remote areas is tempting as the virus spreads, but medical facilities could also be overwhelmed if cases spike there. Since symptoms don't immediately appear, you could be bringing the illness with you. So going someplace else, you could bring that illness with you. Wu said that certainly some outdoor activities are inherently consistent with social distancing rules, but other factors also need to be considered, he said. For example, the risk of injuries that would result in a need to seek healthcare in an increasingly overwhelmed healthcare system, whether the trip results in visits to restaurants or public facilities that would otherwise be unnecessary, or simply setting a bad example for doing road trips when we are advised to stay home. Dr. Wu encourages people to use their best judgment in following the advice of healthcare officials and governments. Okay? That's what they're saying, guys. And some people are like my son, who 2 weeks ago took off to go to Japan. And unfortunately, I am hoping that he can get home. I'm not sure if even our State Department is going to allow people coming from Japan to come back into the United States anytime soon. According to our State Department on the 19th last week, our State Department said there would be a short window available for people to return back to the United States. And that window, I'm sure, is going to close. Olympic champion swimmer was diagnosed with coronavirus. He says it's the worst virus he had ever endured. Okay, several celebrities have said the same thing. Okay, but this world-class swimmer from the United States, Cameron Vanderburg, is about as fit as an athlete gets. The 2020 Olympic breaststroke champion has remained among the top swimmers in the world. But after contracting COVID-19, he said that even the strongest of the strong can become weak, feeble, and out of breath. Those are his words. Those are his words. A congressman was hospitalized with the COVID-19 virus. Now, this man was our own United States Congressman, Ben McAdams, a new congressman, freshman congressman. He was treated with oxygen today in an isolation unit after suffering severe shortness of breath Friday. He said in a statement afterwards, he reported feeling relatively better and said he expected to be released from the hospital as soon as his doctors would allow. Okay, we now have several congressmen and senators, including Rand Paul, Senator Lee from Utah, Senator Romney from Utah, have all come down with COVID-19. Okay, everyone needs to beware. Everyone needs to be wary of what is going on. Now, we got word through the Texas News Studio earlier today that the pandemic is accelerating. The World Health Organization warned about it. It's not a joke. Governor Cuomo in New York demands New York City action as his state hits 20,000 cases and 1% of global deaths. And that's in New York. 1% of global deaths are in New York. Our Treasury Secretary today, Secretary Manchin, says the US coronavirus lockdown could last 10 to 12 weeks. The Pentagon raised its alert level to HPCon-C. That's a high-level alert. International Olympic Committee member Dick Pound says the 2020 Olympics in Tokyo are going to be postponed. The other day, President Trump was asked a question if the Olympics were going to be postponed, and he said that he hoped not. But now the Olympic Committee has said that they're going to be postponed. Also, today, in quite a few US cities, mobile morgue trailers are being deployed near major US cities because the county morgues won't be able to handle the number of people that are going to die as a result of COVID-19. Okay, you guys need to be aware of this. Okay, I posted this up on our Facebook, on my Facebook page today. Okay, everyone needs to be aware of what's going on, and I've tried to keep people aware. I've tried to keep people aware. Dr. Paul Cottrell has said, and he's got a video, and I recommend that any of you that are interested can seek out his videos. But on one of his videos today on YouTube, he said 165 million Americans will be infected with COVID-19. He said 6.9 million people will die from COVID-19 in the next 20 months. Okay, that's what he believes is going to happen. And on his video, he says why he believes that. Okay. The governor in Michigan, has ordered all non-essential Wisconsin businesses closed, and he told residents to stay home. So there's another state. Wisconsin is now shut down, locked down. Okay, what are you going to do? What are you going to do? One of the other articles that I saw today in the Epic Times was 20 million fewer cell phone users in China may suggest a high Chinese virus death toll. As I've stated many times before, that I don't believe that the Chinese have been completely honest with us. They're only reporting 88,000 people that had contracted the COVID-19 virus. But they said things are getting better. And they've only reported like 4,000 people dying. Or it was at 3,000 something, I believe it was. And they said things are getting better. Friends, family, those of you that are watching this program, please be advised, stay home. Take all of those recommendations that we have given you from doctors and healthcare professionals. Stay home. The president has asked for people to stay home. He hasn't ordered it, he's asked it. He's letting the governors be responsible for their own states. Okay? I want, like all heck, to tell you all that everything is better. I want, like all get out, for this whole thing to go away. But unfortunately, it's not going to. Unfortunately, it's not going away. It's quite incredible, in fact. It's quite incredible to know that people are not paying attention. People are going about their own mindset to do whatever they want to do. And clearly, more and more people are getting sick. Clearly, things are happening. And all of us need to be aware of it. All of us need to be aware of it. I don't know what else to tell you. I want it to go away myself, but it's not going to. Now, Robert says, get on with the quakes, period. Enough of this virus crap. Well, quite honestly, Robert, I want to do the same thing, and I'm going to. But we had to talk about this. And I know everybody's getting tired of it. I'm getting tired of it. But if I don't talk about it, who is going to? I don't want to talk about it. I honestly don't. I think we have better things to talk about. I want to make sure people are being safe. I do. I want to make sure people are being safe. And yes, we've had quite a few earthquakes today. We have. We've had quite a few earthquakes. And in fact, I'm going to show you earthquakes now. And I didn't mean to rudely throw the coronavirus in everybody's face. That's not my purpose. My whole purpose today was to bring you the news as it was happening. Now, we've just had a moderate 4.0 magnitude earthquake over here in the Gulf of Alaska. Approximately 170 miles southeast of Kodiak, Alaska, 180 miles southeast of Kodiak, Alaska. Okay. We've also had another earthquake, a 2.8 in Pahala, Hawaii. As we know, the volcanoes are recharging in Hawaii. Specifically, Kilauea is getting its lava from underneath Pahala right now. and that's why Pahala is getting hit. Over here in the Aleutian Islands, a 4.9, 5.0 magnitude earthquake hit over here in the Aleutian Islands, approximately 17 miles east-northeast of Tanaga volcano in the Aleutian Islands. Now, I am going to try to go closer in here to show you where this happened. And this is just a handful of miles from Tanaga volcano. Okay, Tanaga volcano is right over here where you see my cursor. This earthquake was east-northeast of the volcano. Okay. No, the volcano is not going to erupt anytime soon, but I wanted to show you where that was. Okay. Now, USGS is not showing any of the earthquakes that have happened really up here in Alaska at all. They showed us this one here in the Gulf of Alaska. They showed us this minor earthquake. Well, it says it's a 3.1 magnitude earthquake, small earthquake that hit over near Kodiak Island, 88 kilometers, about 50, well, I want to say 50 miles, 55 miles east-northeast of Kodiak. They're not reporting everything, is what I'm saying. Okay, a 3.7 magnitude earthquake west of Craig, Alaska happened today. See where this fault is, this fracture zone is? This is Queen Charlotte's Island. This is north of there. Okay, so you can see the earthquake seismic energy is traveling south out of Alaska. Okay, what else is going on? Today, over in the Triple Junction area, a 3.5 magnitude earthquake hit approximately 20 miles, about 20, 25 miles west of Petrolia, California. It's right in the Triple Junction area. The Cascadia subduction zone. What is this? What is this? This is a fracture zone running off from the shore of California out to sea. Okay. Right here is the San Andreas Fault. Triple Junction area, another earthquake here. Dutch said that he, in one of his latest broadcasts, said that he was expecting a 6 to a 7.0 magnitude earthquake to hit this area. We'll see. I'm actually expecting possibly something even larger. Okay, down here in Southern California, another increase in magnitude, a 4.3 magnitude earthquake hit down here about 14 miles north of Searles Valley. Okay, I'm going to show you something here. Just a second, they screwed up my settings on my map here. They keep doing this. They keep messing with my map here. Okay, I think it's all right now. I hope. All right, it is. It is. Now, USGS does not show anything in the Pacific Northwest. Let's go look at what happened in the Pacific Northwest. Okay, let me take you off the USGS map. Let's look at the EMSC map. Nia Bay, Washington. Nia Bay, Washington, a 2.15 magnitude earthquake happened. Nia Bay. Southeast from there, Shelton, Washington, a 2.21. The magnitudes are increasing, aren't they? Amboy, Washington. What do we have at Amboy? Amboy, Washington, we have Mount St. Helens. You saw steaming at Mount St. Helens in that video earlier. We had a 0.25 magnitude earthquake at Mount St. Helens. What happens with those earthquakes? Even those minor earthquakes, folks, are jostling the plug at the top of the volcano. Okay, just like a cork in a wine bottle, pressure is building up against that plug. Okay, pressure is building. The plug is steaming. The earthquakes that have hit Mount St. Helens have fractured that plug, allowing steam to escape from the volcano. That's what's going on. Again, we had another minor tremor, a 0.25 magnitude quake at Mount St. Helens today. Mount St. Helens. Let's go northeast of here. In Sela, S-E-L-A-H, Washington, is 0.92 today. Okay. Let's go over to Desert Air, Washington, a 1.48 magnitude quake, Desert Air. North of there, Royal City, Washington, a 1.31. Okay, Washington had earthquakes today. Oregon, Yoncalla, Oregon had another quake today. One last week and one today, a 1.98 magnitude earthquake, Yoncalla, Washington. Okay, it's going, folks. It's going. We're seeing more and more earthquakes every day in Washington and Oregon than we've seen in the previous even a year. Even a year. These agencies were not reporting earthquakes to us until now. Now, all of a sudden, they're reporting them to us. They're reporting them. It's about time. Yes, it's about time. But we're seeing them now. We're at least seeing them. Okay, I switched to the map, to the satellite image, so you can see what's going on. See the earthquakes there? 50 there, 50 plus there, 50 plus here. And of course, we get the geysers. Earthquakes are increasing. Earthquakes are increasing. Yes, 20 plus over in Carson City, in and around Carson City, Nevada. They had a 5.1 magnitude earthquake the other night. Now they're getting aftershocks. He said 20 plus. It is a lot of earthquakes around Carson City. Okay. I'm just going to poke around here for a minute. 0.20, 1.0 Minden, Indian Hills minus 0.30, meaning above sea level, minus 0.2, minus 0.3, minus 0.1. Look at where this one is. A volcanic area. A volcanic area, folks. .30 Carson City itself. 1.30 Carson City. Indian Hills 0.1, 0.6 in Carson. A bunch of earthquakes. A bunch of earthquakes. Okay. And they go out from Carson City too. Quite a distance out. Okay. Let me show you them. They go way, this is Carson City right here. They go way out here. Okay. Aftershocks. And it was only a 5.1. It was only a 5.1. You want to see Salt Lake City? We have 20 plus right now. We had a 5.7 on Thursday. 20 plus earthquakes today. Okay. And we just had one hit a short time ago too. Let me see if I can pull up. Okay, I'm pulling up information here. All right, just a second here. I appreciate all the messages that you guys send me. I did get some messages about the coronavirus, and I will go and pull up those messages and take a look at them. Right now, we're going to talk about earthquakes during the next 15 minutes that we have left here. Just northeast of San Francisco, Alum Rock, a 1.02 earthquake. Just right off, just east of the San Andreas Fault there. Further south on the fault, the Pinnacles, a 1.23 area or 2.3 earthquake. The Pinnacles is getting hit because one, it's a volcanic area, and two, they have oil and gas pumping operations going on there. There's a 2.7 also at the Pinnacles. Okay. Just east north of there, Mariposa, California, a 2.12. The seismicity, the magnitudes are increasing. The magnitudes are increasing. Okay. Over here in the Mammoth Mountain area, Mammoth Mountain is a volcano, folks, over on the east side of California, central California, basically. Mammoth Mountain, 0.29, 0.13, 0.13, 0.59, 0.12, 0.49, 1.47, 1.12. Folks, it's hitting all over the place, all over Mammoth Mountain. Okay. Earthquakes are hitting. Before July 4th, before we had that earthquake down in Ridgecrest, California, rarely did we see earthquakes at Mammoth. But after that earthquake hit, all of a sudden Mammoth has been hitting almost every day. Rarely does it not have earthquakes there. We have Big Pine, California, 1.10 and a 1.80. Big Pine, California. Let's go down here to Southern California. Cozo Junction, 1.85, Cozo Junction. Okay, let's pop this 10 plus real quick. We got swarmage, folks. We got swarmage, 1.16, 1.47. These are all at Cozo. 0.94 minus 0.1, 1.15. These are all at Cozo volcano. All of these are at Cozo volcano, folks. They're all over. 0.96 Olancha, California. 1.26, 0.97, 1.04. These are at Olancha, California. 65 miles north of Ridgecrest. Okay. 65 miles north of Ridgecrest. Okay. Olancha, California. What is there, folks? There's a crater there. An old volcanic crater. Olancha, California is getting hit. In fact, on this image, you can see small craters within the caldera area. Okay, you can see small craters there. That's in Olancha, California. There's another one, small, large, pretty good sized crater right there, just northeast of Olancha. Actually, it's northwest of Olancha. Sorry about that. So Olancha got hit. Little Lake, California. Okay, south of Olancha. Look at all the earthquakes down at Little Lake, California. More earthquakes south of there. Let's see what we see here. I've already seen it. 0.83 at Ridgecrest, 1.39, 1.41. We have a bunch of earthquakes at Ridgecrest. A bunch of earthquakes at Ridgecrest. 1.28, 2.35. Cyril's Valley, 1.19. Tom's Place, 2.17. Cyril's Valley, 4.3 today. A 4.3 magnitude earthquake in Cyril's Valley. Okay, Cyril's Valley today. They're happening all over. All over. Johannesburg, California had an earthquake, and it's not listed right in here. Johannesburg, California is right here. It had an earthquake today, but it's not showing now. Okay, just a minor quake, but it's not showing. But what is this? What is this area right here? The Garlock Fault, folks. The Garlock Fault is here. Okay, and it runs all the way down towards Los Angeles. Here in the Mojave Desert is a 1.57, just off the Garlock. Okay. Bodefish, California, just north of the Garlock, 1.40 and a 0.80. Bonefish, California, north of the Garlock. Over closer to the, closer to the San Andreas, Lebec, California, LEBEC, a 1.26. And over here in the Grapevine, Grapevine, California, where Interstate 15 goes up. The Grapevine was hit today, okay? The Grapevine had a 1.67 magnitude quake today. Let's go further south, west of the San Andreas, Gardena, California, a 1.49, closer to Los Angeles. Gardena, California, 1.49 today. See where the San Andreas is? Gardena is right near the ocean there. Gardena got hit today. Fontana, Riverside County, Fontana, 0.80 today. Let's go, and that's right on the San Andreas, folks. Redlands, California, 0.98 and a 1.26 in the Redlands. Okay. Let's go over here to the Anza Gap. We've got the Anza Gap popping, and it's been popping. Okay. The Anza Gap area is 0.49, 0.87, 0.15, and it continues. 1.12, and then we get down to San Diego County. San Diego County. Up in Warner Springs is 0.33. 0.33. Julian, the Apple capital of San Diego, 0.95 today. Still in Julian, a little further south, is 0.79. Okay. Let's go over closer to the shore. Lakeside, California, where I used to live. A minor 0.99 earthquake. 0.99 earthquake in Lakeside, California, where I used to live. Down in Chula Vista, we spoke of Chula Vista Police earlier. A 1.54 magnitude earthquake in Chula Vista, just north of the Mexican border. Okay, Chula Vista got hit. Let's go up to Borrego Springs at the top of the Chocolate Mountains. 0.63, 0.73, 0.92, 1.43, 1.12, Borrego Springs. Borrego Springs. You can see all the earthquakes right in here. Borrego Springs got hit. Okay. Now let's go over to, I love this, Calipatria, California. The Salton Sea, on the southeast edge of the Salton Sea. Calipatria, California. What do we know about Calipatria, folks? Calipatria, California is where that geothermal electrical generating plant is. That's where that is. Okay. Let me show you where this earthquake was. Just part of the geothermal power plant there. That's just part of it. Okay, this is where the earthquake was. This is where the geothermal power plant is. Okay. Now, what do we know about geothermal power plants? I've explained this many times during our programs. These geothermal power plants, they have drilled into the surface of the earth, into the crust of the earth. to extract steam, in this case, from the Salton Butte volcano that's right here. And they extract steam to power the turbines at the geothermal power plant. Let me show you a picture of the turbines at the geothermal power plant. Pull up the turbines here real quick. This power plant is all over Calipatria, California. Pieces of the power plant anyway. I want to show you a picture of the turbines. I didn't think it's going to be hard. I showed you the picture of the turbines before. I don't know why I can't find the turbines now. That's weird. Oh well. Anyway, they pull steam out of the Salton Butte volcano and put it into the turbines to turn the turbines to generate electricity for the Imperial Gas and Electric Company, and probably San Diego Gas and Electric too. That's what they do there. Okay, that's what they do at that power plant. Just thought I could try one more time to try to find those turbines. I found those turbines so many times, and when I want to show them to you, then I can't. That's really weird. Because not all of the turbines are indoors. Down there in the Salton Sea, it's a desert. And some of the turbines are indoors there to protect them from the heat, because those turbines heat up as they spin, generating electricity. So I know that some of them they put indoors, but I've seen the outdoor turbines as well. Oh well. Anyway, that's what got hit, is Calipatria, California today. Okay, plenty of earthquakes, plenty of earthquakes. That was just in the United States. Those earthquakes are just in the United States. Over in southwestern Texas, Pecos, Texas, a 2.9. Odessa, Texas, a 2.20. Okay, Southwest Texas got hit. Okay, let's go over to Oklahoma real quick. A 1.71 in Moreland, Oklahoma. Look at all the earthquakes in Oklahoma. Okay, USGS doesn't show us that many. Okay, they show us one in Hennessy at 2.26. Goldtree, Oklahoma, 1.76. Hennessy is a 2.61 here. Okay, a 2.61 in Hennessy. That's the only one that USGS is showing. Guthrie, Oklahoma, 1.06. Marietta, Oklahoma, 2.14. Just northeast of there. Fitzhugh, Oklahoma, a 1.67. Northeast of there. Quinton, Oklahoma, a 2.26 earthquake. Now, what is this? What is this? Timpson, Texas. Here's a 2.5 in Timpson, Texas. That's Eastern Texas, folks. Eastern Texas got hit. Now, I've told you before that all those earthquakes in Oklahoma and Kansas are oil and gas pumping operations. Let's see if Tipton, Texas has any oil and gas pumping operations. There it is. Oil and gas pumping operations near the earthquake in Tipton, Texas. Okay. Let me show you. The earthquake is right up here. We went right here. That's where that oil and gas pumping operation was. Tipton, Texas. Okay. Tipton, Texas got hit today. And up on the north side of the New Madrid, we had several earthquakes that we want to talk about. And these will be the last earthquakes we're going to talk about today. Here's a 2.1 in Blytheville, Arkansas. Blytheville, Arkansas. Just north of there in Ridgely, Tennessee, a 1.02. And just north of there in Tiptonville, Tennessee, we have a doggone it. Tiptonville, Tennessee, we have a 1.58 magnitude earthquake. The north end of the New Madrid Fault. This is the New Madrid Fault here. The north end of the New Madrid Fault. 3 earthquakes today. 3 earthquakes today. That's what's going on, folks. That's what's going on. We also had an earthquake over in the Cayman Islands area today, a 4.30 today. The Cayman Islands got hit. Over here in the Dominican Republic got hit. Over here in Puerto Rico, Western Puerto Rico got hit again. Southwestern Puerto Rico. Now I'm going to try to get hold of Dominic over there tomorrow morning and see if we can talk to him and bring him on the show. And he has a lot of information for us. So we're going to try to get hold of Dominic and bring him on the show tomorrow. Over northwest of Puerto Rico, off of San Antonio, Puerto Rico, where we had the 6.3 last August, here's a 3.65, an aftershock from that 6.3. Over here in the Mona Passage, we had one other earthquake right between the Dominican Republic and Puerto Rico. This was a 2.8, a 2.8 in the Mona Passage. Okay, we had a lot of earthquakes all the way over in even New Zealand today. The USGS and the other agencies have a hard time making up their minds what they're going to call an earthquake. Earlier this morning, about 7 o'clock, they said they had a 3.0 earthquake. A minute and a half later, they raised it to a 4.8 magnitude earthquake over in New Zealand. Okay. Over in New Zealand. Well, what happened today, this afternoon, over in the over in the Fiji Islands, north of New Zealand, we had a 5.3 today, right up here in the Fiji Islands. But down here in New Zealand, they get hit all over the place. They get hit all over the place. Here's a 4.88. It went from actually it wasn't 4.3. It went from a 3.0 to a 4.8 magnitude earthquake in the Kermadec Islands. In the Kermadec Islands. Came in as a 3. And then all of a sudden they made it a 4.8. I have problems with that. Besides that large earthquake over in Fiji, we had another one over off the coast of southern Chile in the approximately 40 miles off the coast of southern Chile, we had a 5.1. Right down here, 5.1. And then further up in central Chile and going up into Tarapacá, Chile, we had a bunch of 4s, 3s and 4s. Okay, that's what happened today, folks. That's what happened. Anyway, we're going to end this broadcast where we've gone a few minutes over, just past 8 o'clock, but I wanted to show you those earthquakes today too. We had a bunch of 4s over in central New Zealand. We had some 2s and 3s over in Japan, a 4.9, 4.9, 5.0 south of Japan in the Ryukyu Islands, south of Japan, Ryukyu Islands, the 4.9, 5.0 south of Japan down there. Also just south of Kamchatka. South of Kamchatka, we had a 4.38. This earthquake will travel up here and across into the Aleutian Islands within the next day or so. So that's what's happened. That's what's happened today. I want to thank all of you for having been with us today. We really appreciate it. We really appreciate all of you being with us. Thank you for joining us. I'm looking at the chat room here. I wish that I had had more time to spend with you in the chat room today, but there was so much information that we wanted to give you. And I'm sorry you didn't hear Glenn Beck. I will try to find what he said and play it for you possibly even tomorrow, because there's a lot of great things that he had to say that I believe that you guys needed to hear. Anyway, thank you for being with us. God bless. Do know that we love you. Thank you too, Marshall. We appreciate you. Please do know that we love you very much. I meant what I said at the beginning of this broadcast about all of you. You guys are so valuable. You guys make it so worth doing our show and bringing the information to you. It's a pleasure to be here with you. God bless. Do know that we love you. As Walter Cronkite has said, and that's the way it is. Monday, yes, it's still Monday. Monday, March 23rd, 2020. For Emergency Management Associates, this is Ron Tyler. Have a great evening, folks. We'll see you soon. Well, I thought it was going to play. Good night, everyone. Thank you for joining us. If anything else happens, we'll be back here to bring you the information as soon as it becomes available. See you soon.